All right, so if you clicked on this video, you're probably wondering what is in this foot. So this is a very interesting story. This patient was sent to my practice for what they thought was some type of mole or a lesion on top of their foot. A previous physician or an emergency room, I can't remember the exact situation. The patient was evaluated. Now, it was several days before what you're actually looking at now, so it was not as obvious to them. It was just starting to come through the skin, but they were concerned as there was something on top of the patient's foot, and they didn't know what it was. Now, this was a previous patient of mine, and they had had a severe fracture dislocation of their midfoot, something that's known as a Liz-Frank fracture dislocation. And we repaired it. We put screws and plates in. The patient did fine, and they had been home living, going about their business for the last 2 to 3 years with no problems, until now that something was coming out of the top of their foot, and it was actually a screw. So by the time they came into my office, that is what you saw. There was a screw coming out of the top of their foot. It had already pierced through the skin, and it was open and prevalent and easily seen. So at that point in time, I had to make a decision. Well, what do we do? Do we start the patient on an antibiotic and wait and take her to the operating room to take it out, or do we obtain the proper screwdriver for this screw and remove it? And that would be the simplest thing to do. If the patient was not infected, there was no redness, no pus coming out of the foot, it was just a painful area that was obviously the screw backing out. So what we did at that point in time was, I have a good relationship with the orthopedic company that manufactures this hardware that we put in. So I called my rep for them and said, hey, I have a screw in a patient that's coming out. This is when we put it in. Do you think you could get someone over here with the proper screwdriver so that we could take this out? I told the patient, you're just going to have to wait if you're able to. And they were obviously not going anywhere. They had a screw coming out of their foot. So the decision at that point was to wait and remove it. So we put them in our minor procedure room, had them wait, and within the hour, we had the orthopedic rep arrive with the proper screwdriver. And it was a hexagonal type screw, as you can see. There's a specific fit for these screws. And if you have the wrong screwdriver, you can imagine, and you tried to take this out, you could actually strip the head of the screw, and you don't want to do that. So we had the proper screwdriver brought in sterilely, and we backed the screw out. You can see it was very simple. It was loose. It came out easily. You didn't see in this video, we did numb the patient. A local anesthetic agent was used to numb the area so that they weren't having pain while we took it out. And it was removed. It was flushed out with a considerable amount of saline. Patient was started on an antibiotic for the next 7 days just to ensure that no infection could occur. Because remember, this is coming out of bone, and you want to make sure that there is no bacteria that's entering or exiting from the bone area. The good thing was that there were no clinical signs of infection. Now, you could say there's an open wound and there is exposed internal bone from where this screw was, but if there's no bacteria, we flushed it out. We used betadine solution as well. Patient was started on an antibiotic, and we did have them come back within several days to ensure there was no infection. There was none. The patient did fine. But you can see we put a single stitch in this area after removing the screw, and then a bandage gets applied. The patient can walk out. So then the question you're probably asking yourself is, well, is the patient's foot going to fall apart now that this screw was removed? Well, here's the x-rays, and you can see in these x-rays there are multiple screws and plates and a plate on this patient's foot to put the joints back together. Now, usually when we do this, after so many weeks, the area consolidates, the ligamentous structures and the soft tissue structures heal themselves, and the plate and screws are no longer needed, or in some cases, we actually fuse these joints back together. But in this patient, we just left the hardware intact. They were doing fine. Sometimes we'll do that. She was a lighter person, an elderly person, so the activity that she was doing wouldn't be such that we would be concerned about her breaking the screws or the plates, so it was all left in. And it can be left in with no issues, but if it starts to become painful or prominent, you can remove this hardware and nothing will happen, because at that point in time, the joints have either fused together or the soft tissue structures that we repaired have healed themselves. And that was the case here. So the screws can come out, the patient's foot won't fall apart, and they can get back to normal activity. And then within a week's time, this stitch will be taken out, the skin will heal, and the patient will be back to normal activity. If you have any questions about this procedure, or there's anything else you want to see, drop a comment below and we'll be sure to answer them. Thanks for watching.